KZSU-FM Stanford. Welcome to another edition of Hearsay Culture on the Hearsay Culture Network. My name is Dave Levine. I'm a professor at Elon University School of Law, as well as a longtime affiliate scholar at the Center for Internet and Society at Stanford Law School. Currently affiliated with the University of Milan's Information Society Law Center and the University of North Carolina's Center for Information Technology and Public Life. Today, I'm very excited to have on two members of Microsoft's AI for Good lab, Juan M. Levista Ferres and Bill Weeks, co-authors of the new book, AI for Good, Applications in Sustainability, Humanitarian Action, and Health. The AI for Good lab at Microsoft started a few years ago, and its focus, as the name suggests, is to harness the massive power of artificial intelligence, not just generative AI, which of course is the focus today, but AI generally for, as the title suggests, good. We've had on Hearsay Culture over the last year a number of guests that have talked in this space, including Orly Lobel and others, who have talked about the great potential around artificial intelligence and as well the risks associated with it. The risks associated with AI are increasingly well known, but not well understood, particularly as balanced against the benefits. And lots of the discussion around artificial intelligence, particularly after OpenAI released to the public its ChatGPT in November 2022, has been around the question of, should we have this technology at all? Do we want this technology? And what should we do about it? Unfortunately, as is often the case in the world of particularly complex topics and ones that are not well understood, polarization has set in. And so there tend to often be, at least in public policy, two camps, right? There's often a camp that speaks very loudly that says, let's ban it, or at least let's prohibit it dramatically. And then, of course, there's another camp, which we often hear from, that tend to downplay the risks and more or less talk about its positive attributes. And in the AI for Good book, the primary function of the book, without question, is to share, and it's really an incredible compendium, dozens of case studies, literally, around how the lab has harnessed AI technology, harnessed large language models, harness natural language processing, and harness generally machine learning by working through massive data sets in order to assess everything from how giraffes behave to what we should do about COVID. And while it is absolutely critical that we understand how this technology works and how the technology is used, it's also very important to hear from researchers, and particularly researchers with the resources that Microsoft has, about how this actually can be done. And so what's very exciting about this book in particular is that not only do the authors, who I'll introduce in a moment, share these case studies, but they very importantly talk about the limitations of the technology itself. And so in that sense, the book is extremely useful, particularly not just for researchers and for policymakers, but also for concerned citizens to learn really what this technology is capable of doing. And from that perspective, the book, I think, is very optimistic and very encouraging. On the other hand, there are also risks associated with the technology, ranging from privacy concerns to existential concerns that may not be adequately understood or addressed here, and we'll talk about that a little bit as well. But again, the book itself is written with these broader positive policy uses and real-world uses in mind. So we're very fortunate to have the two authors of the book on the show. In order of how they are identified in the book, Juan Ferres is the Corporate Vice President and Chief Data Scientist for the AI for Good lab at Microsoft. Juan started the Microsoft AI for Good lab efforts related to sudden infant death syndrome, and his work was published in top academic journals such as Pediatrics. He is widely cited and interviewed in the media and has a lengthy background in that space. Bill Weeks, MD, PhD, and MBA, is a physician economist at leading Microsoft's AI for Health effort. He conducts research in concert with non-for-profit organizations and academic centers designed to improve health. He has published a book and over 200 peer-reviewed manuscripts. And we're going to skip, Bill, a lengthy discussion of the peer review process, which I have very strong opinions, but I'll share that maybe off air, and is doing incredible work there. Bill Bill is joining us via Zoom from New York. Juan is joining us from Redmond, where Microsoft is located. And we are recording on August 28th, 2024. Gentlemen, thank you for joining me on Hearsay Culture.
Thank you.
pleasure.
Juan, let me jump right in and ask you, right? The book is a lengthy list of case studies, and I'm curious to jump right in and ask why you felt it was important to have a book like this in the public arena right now.
So when we started the lab around 5 years ago, we worked with organizations around the world to help them solve their problems. Our expertise is AI and data science. We partner with organizations like the ones that are in the book that have subject matter expertise. But one thing that was recurrent for us, it was difficult for researchers or organizations that we partnered to understand what they could do with AI. So what we typically would do as one of the first presentations to them was showcasing some of the examples on how AI was used in other projects. And they found that was like in many ways, that was the driver of many of great projects, started by showcasing what we call the art of the possible, like what is possible to do with AI and this technology. And that became recurrent. And that's why we had the opportunity to say, hey, let's actually write a book to tell this, so like it can help others understand what is possible to do with AI in this field.
And with regard, and Bill, I'll turn to you, with regard to the case studies themselves, they run a massive gamut, as I mentioned in the introduction. It's really incredible. But I'm curious, how you pick and choose, right, what to do with this technology in light of its capabilities, which, we're still only scratching the surface on.
So we are quite interested in potential impact. So as Juan said, we want to say this is the art of the possible. This is what you can do with this new technology. And we are curious about how to improve the world. Both Juan and I are researchers at heart, I think. We want to do good in the world. AI is a tool to be able to do that. And so, I focus on healthcare because that's kind of where my area of expertise is. But the lab as a whole focuses also on sustainability and humanitarian action, which are kind of the three different sections of the book. So I think the point maybe is that this common technology, which can look at massive amounts of data and do much more sophisticated statistical analyses than just a typical linear regression or something like that, can be applied to all sorts of areas of social good. And the book just kind of highlights the various aspects of social good that it can contribute to.
Now, Bill, I do have to follow up, and I'm going to do it here because I'm a law professor. You've written lots of academic pieces, and you point out early in the book that that the academic writing perhaps was not the focus that you wanted to do because of at least the perceived limitations of academic writing, given the amount of not only law students but also academics across a range of fields that listen to the show. I'm curious if you could talk a little bit about that and how your academic work informs what you're doing now, but also more broadly, the impact of academic writing as you experienced it.
Yeah, so academic writing is, for a particular audience in a particular format with a particular kind of way that you go about things and explain things. We wanted this book, very specifically to be more accessible to a lay public, so that they need not have a PhD like Juan has or I have to be able to interpret this stuff. So most of the case studies actually are academic publications as well, but we kind of wrote it in a format so it would be more consumable by a general population. Because again, if it's limited to academic journals and you look it up in JAMA or something like that, your readership is fairly focused. Here, I think we just wanted a broader audience that could see what Microsoft is doing with this technology.
And Juan, let me turn to you on that, right? Microsoft, obviously is not only a giant, right, in the growth of the PC, but also is an investor in OpenAI. But this is a project distinct from OpenAI, and I'd like you to explain that to listeners, because I do think Microsoft, as we talked about a little bit before the show, I think Microsoft, and because of its heavy investment in OpenAI, is often merged with OpenAI in these kinds of discussion. So could you clarify that for my listeners and really for everyone who wants to understand a little bit more on the research side of what that relationship is?
Yeah, OpenAI is an independent company, and we use, of course, we use the service, including some of the projects that we have in the book are using the services. Like we feel that the technology like GPT has a tremendous impact in the world, and of course, as part of that, we use the services. But these companies are independent companies.
Mm-hmm. Do you share research or share concepts, or is there a separation even on the research side of things?
Well, on our side, no, we are completely independent to them. Like we use their technology, we use their models basically through Azure, through our Azure services. But yeah, we don't have, there's no collaborative research with them. We could potentially have, like we have with other organizations, but we don't have with them.
I got it. So yeah, so tell us a little bit more about the lab itself in terms of its resources. The mission seems fairly obvious, but the resources and a little bit more about how you develop these projects.
So the lab started around a bit over five years ago. The objective is to use AI to help with some of these organizations in the world. It's a completely philanthropic effort. Our contributions are both on the compute side, like projects that need AI compute that need basically like Azure. We can provide that, but on top of that, we provide our AI expertise. So what we get from multiple different forms, whether it's they reach out to us, we reach out to them. There is someone that knows us that make the connection. From multiple sources, we get a funnel of projects, and these projects have like a big variety of projects, and we go actually every week we meet with a team, with the leadership team, to go through some of these proposals. And we work in monthly sprints. So even though we are a research team or applied research team, we work more like engineering in that side. We work in monthly sprints, but every week we prioritize projects. And as part of this prioritization, we start with the funnel start with all the requests we get. From those requests, we analyze how many of them we can actually have. Like, is this a problem that we could potentially solve using AI or data science in general? There's a lot of problems out there that are very important. Not all of those problems can be solved using AI or technology. From those projects, do we have, or do our partners have, data, or the right data? Because a lot of problems are important. A lot of partners are the right partners, but they don't have the data to solve the problem. Majority of these problems cannot be solved if we don't have data. Not all problems, some problems can be solved without data, but a lot of problems require data. Once we get an understanding of the data, do we have the right partner? Correct. So we are not subject matter expertise, although we have people like Bill that are like he's an MD. For majority of our projects, we don't have that expertise in house. We need to partner with these organizations that have that subject matter expertise. And the question at that point is, do we have the right? Is this the right partner to do the project? And that includes questions whether, for example, let's say we're working on a sustainability project. If we can make this model that they're asking us to help them, do we think that we eventually could do a knowledge transfer, a technology transfer to them, so they can take it from us and run and just do it by themselves, correct? Once you start going through the funnel, then you get a much less amount of projects. And among those projects, every month, we prioritize based on impact, which is that, like Bill mentioned, it's very important for us to have an impact in society. We try to look for those projects that have the higher possibility of impact, the lower possibility of failure. We will have projects that fail, that is part of our portfolio. But we try to look for that low-hanging fruit that is very impactful projects that we know that we could potentially solve and have an impact.
Bill, the notion of low-hanging fruits and solving intractable healthcare and medical quandaries seems to be not a lot. It seems like the low-hanging fruit we kind of maybe got to already. And so I'm curious, coming into, and I know you've been with Microsoft for a while, coming into Microsoft, share with us a little bit your experience in managing and utilizing the resources and expertise in the lab to address some of these health concerns. I mean, and I'll just take COVID as an example, although there are many. Aside from the development of mRNA vaccines, the book talks about other projects related to massive analysis of data, right? For example, in order to address other intractable problems. Having Microsoft as a platform for that kind of work is pretty remarkable.
Yeah, it's astounding. I was at Dartmouth for 25 years, including my residency, and worked as an academician there. And we dreamed of having the ability to analyze very complex data sets. Like I mentioned earlier, you can kind of use simple tools like regression analysis, and that's how a lot of healthcare stuff has been done. But we know, for instance, that social determinants of health have a bigger impact on the health of a population than healthcare does, right? So it's just very hard unless you have these models and machine learning capabilities to integrate and look at those very complex nonlinear relationships that exist. And so to me, the dream job, frankly, has been something I was wanting to do for 25 years at Dartmouth, because when you actually have some of these resources, you have incredibly bright people that Juan's hired over the years who are very skilled at doing the machine learning, who also, a nice thing that I think Juan kind of suggested is we have to have subject matter expertise, right? We need to have, just computer science alone or AI alone, if applied kind of willy-nilly, it will not be a helpful thing. You got to have the subject matter expertise to work in partnership with the AI folks to craft, a research question that's answerable, and to think about how to interpret the findings, right? That's kind of critical. So just the complexity of data, the complexity of the world, and the interaction of all these different variables is what makes the AI capabilities really attractive to me.
What strikes me there is one of my mentors, and I was affiliated with the center for a few years, is Ed Felton at Princeton. And as you know, as I'm sure you're familiar, Ed was one of the leaders in encouraging and really pushing for technologists, for researchers, for people who are doing this kind of work to recognize the ethical dimensions of the technology itself. I think, frankly, to be very candid, I think a cynical view of large corporations like Microsoft is that ethics kind of go by the wayside, or at least that they're not there. And so I'm curious, in light of your experience and what you're saying, how as a researcher with the resources of Microsoft, the role of ethics and values has influenced, and how much it's influenced your work there.
I think it's very ethical. I think, the mission is to empower every person in every organization on the planet to achieve more, right? That's Microsoft's mission. I think the AI capabilities, particularly in healthcare, can help do that. We have ethics reviews. We follow, we get things IRB approved. We do the training, the human subjects training, and we go through peer review to ensure that things are kind of above board. Furthermore, Microsoft has an Office of Responsible AI and has been involved in responsible AI for, I think, something on the order of 20 years, with this office established maybe 6 years ago or so. So I think Microsoft very seriously takes the ethics of a new technology into consideration. And even when we do things, as Juan was saying, we might even say to a partner, yeah, this isn't the right tool for this question, right? So again, we don't want to, when I give talks, and particularly around healthcare, there's a concept called the quadruple aim in health, which Don Berwick can help develop from Institute for Healthcare Improvement. And what I continuously say is, unless we're kind of improving at least one of the quadrants of the quadruple aim, we shouldn't be doing the thing, right? We shouldn't be applying something. Bill Gates had this great quote that we'll often kind of include in talks, which is that, if you use technology in an efficient organization, the organization gets more efficient. But if you use it in an inefficient organization, it gets more inefficient, right?
Right.
It accelerates the inefficiency. And healthcare is not known for efficiency, right? So I think we have to be kind of careful. And to get your ethics question, we have to be careful in the application of AI. Concerns about biases, concerns about not actually improving the health of population, but adding additional technology are very real concerns for us, and we address them.
We're chatting with Juan Ferres and Bill Weeks, co-authors of the book AI for Good: Applications and Sustainability, Humanitarian Action and Health, on Hearsay Culture and Hearsay Culture Network. Juan, it's interesting to hear Bill talk about this, because I was in preparing for today's discussion, I was looking at recent commentary on Microsoft and on the AI for Good Lab. I came across an article that Politico EU posted. You maybe, I see you smiling a lot. Maybe you're familiar with it, or I'm curious what the smile is. But be that as it may, the title of the article is "Microsoft Goes from Bad Boy to Top Cop in the Age of AI." Now listeners are going to light up here. Let me be clear: Juan and Bill are not attorneys, and I'm not going to ask about law here as much as law professors want to. But it's a subtitle that I thought I'd ask you about. The tech company fields team. This is the subtitle from the article. The tech company fields teams of disinformation hunters, computer scientists, and policy officials in a bid to stop artificial intelligence from gate crashing the 2024 global election cycle. And so, of course, look, let's be clear, we Politico, like every other organization, wants people to read. It's a pretty good title. But my question for you is this, right? Even Microsoft, right, has its limits. Right. I mean, I think to say Microsoft or any entity is going to solve the problem of artificial intelligence and elections in the next 3 months is unrealistic. But I'm curious, from a big policy perspective, where those kinds of issues, right, elections and integrity of elections, fall in your thinking about where the AI for Good lab should be focusing.
So for us, what is critical is to understand how technology. There are two fronts that we care, correct? Like on one side, how technology and AI can help society, and on the other side, how technology could be used as a weapon, correct? And in this particular case, through generative AI, we are worried about the potential use as a weapon, particularly related to disinformation. That's what basically the article on Politico talks. And as part of this, what we've been involved is, can we use AI? Can we use our own methods to detect generative AI? Correct? And as part of one of the problems that we've been working on with there's a lot of people in Microsoft really working around disinformation, and there's specific teams that basically their job is to track and to understand this information. And we partner with them to use AI models to help them detect the use of generative AI, because we are worried that technology could help spread disinformation, spread fake imagery. As part of that, we believe that education is critical. We actually created a game, and we can share the link if you want later on.
Yeah, please.
Real or not, where we ask people to actually try to find whether the image they are seeing is a real image or not. Because it's good, like you mentioned, no entity, no company, no government will be completely able to solve the problem on disinformation or the problem on the fakes. What I think is very important for society is to understand that this exists. Understand that if you're seeing a picture of your political candidate doing something, well, you need to understand that there is a chance that image was created using generative AI. And again, part of our job, part of what our team is contributing is to build AI detectors where you can use AI models to detect if the image that you're seeing is a real image or the image that you're seeing is an image created by generative AI. It has limitations, meaning we know it's not going to be perfect. But and that happens with any detector, by the way. Like whether you are in an airport and you have a detector there of things that you should not carry in a plane.
Right.
No detector technology is perfect, but it's going to help. It's going to help at least prevent part of this issue. So.
Yeah, Juan, last question and kind of like with the back office, as it were, of how the lab operates. So about a month ago, I had Jeff Horowitz on from the Wall Street Journal, who wrote the book last year, Broken Code, right? About his, about really the explosive information shared by Frances Haugen and the background of the battles over disinformation and election interference as related to Facebook. I'm not asking you to comment on that, of course. What I am asking you is this. The book laid out that there was a lot of tension within Facebook with regard to how to address these issues. And there was a tension between, right, the more or less the goal of profits, which any private entity would have, and certainly is laudable, right, against these concerns. And I'm curious, as you think about the tension, as it were, in any profit-making entity between generating revenue, and not just generating revenue, but earning profits, right, against the concerns associated with, for example, right, slowing down in order to solve problems which could impact revenue, or, right, put it differently, right, the tension between making money and being thoughtful. And I'm curious, as you run the lab, if again, I'm not asking you to comment on Facebook, but if those are the kinds of things that you think about, and if so, what your thoughts are.
So every project we have, it goes through, like Bill mentioned before, it goes through an extensive responsible AI framework. We actually have, and I have to say that I feel really proud about Microsoft's approach to this particular problem. Not because people are thinking how to use technology for wrong, but because sometimes it's difficult for people to think that this technology could potentially be used for wrong. And those are the questions that responsible AI, our responsible AI framework and the responsible AI process we have ask. Because many times you are trying to solve a particular problem, but you don't know that maybe that same model could be used for something else.
Yeah.
And those are the questions that we, from an ethics perspective, those are the questions. So yes, we go through a very extensive review process to try to minimize like I said, the use of this technology as a weapon rather than as a tool.
Right. Bill, let me come to you on that. Actually, you know what? I'll do our quick break now and say you're listening to KZSU-FM Stanford and Hearsay Culture on the Hearsay Culture Network. KZSU is a nonprofit, non-commercial radio station at Stanford University that requires donations from listeners to continue its diverse programming. Do email us at donate@kzsu.stanford.edu to continue our programming and to support our efforts. So again, we're chatting with Juan Ferres and Bill Weeks, co-authors of the book AI for Good. Bill, one of the, and now we're going to get right into it because I want to talk about open data. This is a gigantic topic. It's one that, really since the dawn of technology, right, there's been a concern about, do we share data? Do we share information? Do we not? But it has particular currency in terms of open data and sharing data as it relates to healthcare. So for the benefit of listeners who aren't familiar, how do you define open data? And then if you could share with us some examples of why data needs to be shared, particularly in the context of using AI in order to address the problems in health.
So that would probably be a better question for Juan to answer.
Fair enough. Fair enough, Juan. I'll come back to a healthcare question for you in a moment, Bill. Thank you, Juan.
So in many ways, in order for us to do the work, in order for us to help society, we need data. And there's a lot of examples, including a lot of the examples in the books. In fact, one of the early projects that we had that started this lab was a project in SIDS. SIDS, sudden infant death syndrome, is one of the numbers, I think is the #1 cause of death in children between 1 month and 1 year old in the US and in a lot of developed countries. And in order, the reason why we could do this project was because the CDC has this amazing open data set that has every single child that was born in the US for the last over 30 years, and a cohort of the same cohort of 1 year cohort, whether you know if the child survived or not. And that data set is being used actively for many researchers around the world to publish a lot of the learnings that we have in SIDS and other infant mortality in the US and in other countries come from the fact that that data is available. So we strongly encourage and believe in open data. Every project we have, whenever possible, we try to open data sets. Sometimes it's not possible to open data sets. There's very good privacy and reasons not to open some of the data sets. We also need to be respectful for our partners. Some organizations, that's sometimes the differentiation they have is the data. That's the investment they have is the data sets. Unfortunately, and this is something that I believe hopefully society could eventually change, we don't give enough credit to the people building these data sets to begin with, correct? Organizations spend a lot of efforts building these data sets, and then people use them, and some usually they take the credit, like the people either publishing or building models take the credit, but not the people that actually spend a lot of effort building these data sets. And I think we need to find ways to give back and to make sure that either the people get credit or those projects get credit. Because a lot of things, thanks to open data, and Microsoft has a specific program where we help organizations open up data sets. And basically, like we are trying to, like, let's work with society to make sure that we open up more data sets, because a lot of people say data is the new oil. Data has nothing to do with oil. Data is the new code. When we're thinking about AI models, data is the code behind those AI models. So, like from a research perspective, from a machine learning model or AI models, opening up data will help society. So yeah.
And I want to come back to that, Juan, in a moment. Bill, I'm not giving up on asking you a question here. I finally struck out there with asking the wrong person, but now I'm going to ask one I think is right for you. Part 4 of the book, you share a statistic which I did a double take on, and I think listeners would find surprising. You write in the book the tension between the goals in public health is reflected in funding. In the United States, you wrote, only about 3% of total annual health expenditures is spent on public health, while the other 97%, about $4 trillion a year or 18% of gross domestic product, is spent on healthcare delivery. Okay, 3% on public health, 97% on public delivery. I work. I mean, I'm not an expert, but I work in transit into these areas. I was stunned by it. And you talk about how AI can actually help to balance that a bit. So can you share a little bit more about how that might work, and again, how your work is impacting it?
Yeah, sure. So that's a real statistic. I think I mentioned earlier that social determinants of health, like where you live, the conditions where you live, your income, things like that, have a much bigger impact on your health outcomes than actually health care does. And that the part of that disconnect between the 3% and other countries is kind of part of the explanation for why we spend so much on healthcare per capita in the U.S., but our outcomes are pretty lousy, right? Compared to other countries, because they invest much more in social systems and public health administration than we do. I think what we can do with AI, and we're doing this in fact with the Novartis Foundation and the AI for Healthy Cities effort in multiple cities across the world, is try to look at these social determinants of health and then suggest with AI modeling what are the best targets for improving the health of a population. So which social determinants in which geographic settings within the same city, within New York City is one of the cities, might we target to improve, for instance, diabetic outcomes or hypertension control or things like that. Thinking much more kind of rationally about if we invest in these social determinants of health, we get a return on investment to health of the population, and actually maybe decrease the spending on health conditions because we can avoid them. If we can avoid diabetics, diabetes, then we spend less on people. And if we can do that by interventions in social determinants of health, then maybe that will be a really good longer-term solution for the population and might kind of correct that balance by driving down healthcare costs and maybe letting the public healthcare costs increase a little bit.
Yeah, as I read through the case studies, Bill, one thing that struck me, and it was alluded to earlier, is that famously, Edison, failed 6,000 times before he invented the light bulb, right? And the time and effort and costs associated with that kind of experimentation are massive. And I'm curious whether you see AI is not only speeding things up, and not only finding correlations and relationships that we wouldn't understand, but also giving us a much more targeted approach to what we can realistically solve and what we need to wait on. In other words, prioritization. And I'm curious whether you see AI, particularly in public health, where the problems, seem not only potentially insurmountable, but endless, whether AI can help us prioritize and to go to the point earlier, right? Get the low-hanging fruit, right? And then work our way up. So is that something
I absolutely think so. And I think that's part of the modeling aspect. So I think you develop these models and then you kind of model into the future and you say, if this changes here for this population, you can be much more targeted. So it's similar to kind of precision medicine, but it's precision public health, right? We are precise. We say this area, this population will get the biggest bang for their buck if we invest in this versus that. So let's do that. And let's actually help politicians make rational decisions, right? And because, in a way, right, if you think it from an investment standpoint, if you just do the same thing for everyone across Manhattan, it's not going to be very effective, right? Because a lot of people need to be very targeted, very precise, which is kind of a medical model, right? We have appendicitis, we don't just gut the entire gut, right? You just take out the appendix. So you focus your efforts. And that's what I think AI can help do for public health, help focus the efforts, understand where the biggest return on investment is, and then prioritize exactly as you're saying, do this one first, do this other one second, and then get better, faster results.
Juan, I want to, with regard to that, I want to return to open data for a moment. Aside from privacy, which is also a gigantic topic, there's another concern about open data, and I'm curious what your opinion on is. And it boils down to this: the more we share data, particularly valuable data, the more we allow, not just national or U.S., the enemies of the United States, but also, right, malign actors, right, get the power that would otherwise be harnessed by, to use your word, for good, right? And that you create a war of attrition, right? That there's an escalation. So that data, therefore, needs to be controlled. And of course, we see this discussion in the context of code as well. Data needs to be controlled in order to make sure, to use a loose term, the bad guys don't get the data that they can use to make things bad. We talk about biological weapons, but it's even more basic than that. It's just, right, malign forces. Is there, and how big a concern you think there is, that open data allows for bad actors to improve their game?
So let me tell you a thing. I think the question is, do we need to think about sharing data? The answer is yes. And we go through similar type of reviews, like the ones I mentioned before for our AI for Good projects, related to opening up data. And in fact, Microsoft has a history where we actually have taken decisions not to open data. For example, one of the earliest scenarios were a data set that was created by Microsoft researchers around face recognition. And there are a lot of examples where face recognition can help, right? There's multiple scenarios. However, there are scenarios where you can use these models for targeting or for privacy considerations that could be problematic. These are some of the questions, and that's the reason why I decided we're not going to open up that data set, or we're actually not going to invest in that data set. There are cases where some of these models could potentially be used for the wrong purposes. Like we haven't gone through a lot of those cases, at least in our lab, where you could say, well, could this potentially be used for wrong? But there are scenarios, like I do, Dave. I do agree with you that there are scenarios that could happen, and I think it's important for society, for organizations in society, for asking those questions. Could these data in the wrong hands be used for the wrong purposes? So.
And of course, there's a tension there too, Juan, because the data, to be clear, right, is valuable, right? It's valuable to the holders of the data, right? Data, and again, it's only law I'm going to say, all right, are classic trade secrets. They're valuable because they're not known by competitors. And so there's a tension, right, throughout the research world, particularly, right, in accessing data for research that others don't want to share because, right, that creates competition. How do you address that kind of concern, particularly operating as you do at Microsoft?
Well, I think that's clear. Like I mentioned before, data is like code, correct? So if an organization, the value of that organization is the data they have, and that the whole value of that organization is the data they have. Well, if suddenly you cannot ask that organization to share the data, because by sharing the data, basically they are sharing their trade secrets, they're sharing their IP, basically.
Yep.
So and there's a lot of cost. Majority of these data sets have a lot of cost to build, basically. So of course there are multiple scenarios where these organizations have all the right not to share the data, correct? And we will be completely respectful for that. Licensing can also help. There are licensing that are specific for researchers. There are licensing that you can license data for no commercial purposes. And actually, there are multiple organizations around the world that they will open up data, but for no commercial purposes.
Right.
So there's also ways in the middle. There's also organizations. There are also, for example, we're currently working, like you mentioned, on the deepfakes. So deepfakes detections need data, correct? But if I'm a bad actor and I can replicate the deepfake detector that you have, I could use the same model to try to circumvent your model, to attack your model.
Right.
And that's one of the reasons why, yes, data sets for deepfake detectors or deepfake detectors in general should not be made publicly available, because you don't want bad actors to be using those to create those models or to defeat those models. That would defeat the purpose of deepfake detection. So I think what is important is, yes, we need to do we for majority of the scenarios, we do good by sharing data. There will be a scenario that we should not be sharing data.
And one of those, Bill, of course, when we're talking about healthcare in particular, right, is private, right, healthcare information, right? We've talked a lot about, studying in terms of, research, but also there's the data itself collected from individuals, right? And it's the kind of information that's heavily regulated, and we won't get into HIPAA, right? But it's also the kind of information that people rightfully, right, individuals are very concerned about sharing. I mean, it's still more or less, right, difficult to have public discussions about certain medications because people don't want to admit that they have a certain illness. And of course, it's no one's business. Yet that's the kind of data, right, from the perspective of trying to help consumers, it could be very valuable. I'm curious, when you think about this, not from the medical research perspective, but you think about this kind of heavily data-dependent AI research from the perspective of consumers, right, from patients, notwithstanding the fact that as you write in the book, that people agree or opt in to these programs, and I will express some skepticism, which I've had in other discussions about whether people actually know what they're opting into, but I'll put that one aside. I'm not going to ask you to answer that one, but I will ask you the question in terms of how you think about that as a researcher, as a medical researcher, from the perspective of the patient or of the consumer.
Yeah, so I always think that patients and providers kind of want good outcomes for themselves and for their patient population. And as Juan said, and you pointed out, right, we have to have the data just to figure out what's better, right? And you can do randomized controlled trials, and that takes a long time. I think there's the opportunity to kind of do retrospective randomized controlled trials if you have adequate data. But the cool thing is there's privacy-sparing processes that can be used, right? Where either your digital twin, you create synthetic data sets from other data sets. You would use federated learning across different healthcare systems, particularly if the data are harmonized and are good quality. So there are ways to preserve privacy while still analyzing and getting access to the data in a very safe way, very protected way. At Dartmouth, for years we used Medicare data sets, right, which actually had very individual level data, and you had to do this, and you had to go through ethical guidelines about you couldn't publish on a cell that had less than 10 people represented in the cell. So there are rules around this that are kind of older for preserving privacy. These newer rules, I think, will make actually privacy preservation much stronger and allow for different healthcare systems, different insurers who are the ones who have all the data to actually share their data in a way that can be compatible and can offer many more insights than just one healthcare system looking at their own data.
We're chatting again with the authors of AI for Good Applications in Sustainability, Humanitarian Action, and Health, Juan Ferres and Bill Weeks on KZSU-FM Stanford and Hearsay Culture. Juan, you also talk, and we've alluded to it, I want to make sure we're clear about this, right, that of course, as certainly Hearsay Culture listeners know, right, data itself can be biased, right? And we're not just talking about algorithmic bias, but we're talking about the data itself. And you write in the book, models trained on data are only as good as the data they use. You go on to say a significant portion of the data we collect has some bias. If we don't understand these potential biases, our models will not be correct. Now, that's a big risk. But my question is, do we understand these potential biases, or how well do we understand them today, August 28th, 2024?
I think it will depend on the data sets we collect, but I think that's one of the first questions we ask ourselves. A lot of times, researchers and people don't know about what are the potential biases. One of the best examples was a paper published in Nature a couple of years ago by an amazing researcher, some of the best AI researchers in the world, and they was studying skin cancer. And they have all of the pictures that the dermatologists collected on the positive ones, the ones that have cancer. And they didn't have enough, there was not enough data on the negative ones. So they just used a lot of the pictures on they actually had the negative ones too. But one thing they didn't realize when they were doing the model was that the pictures of the positive ones, and by the way, the model was amazing, like it was 99% accurate. Like it was perfect. Like just taking a picture of a skin lesion, a model could tell you whether that skin lesion had higher chances of cancer or not. So it was like a huge success from an AI model perspective. But they didn't realize that. I don't know if you have been to skin doctors. I go to skin doctors every year.
I have. Yep.
When the doctor is really concerned.
By the way, that was not a HIPAA violation because you shared it. Just to be clear, right? Because you shared it voluntarily, and so did I. But there it is. It's on the air. Dr. Weeks, I hope you feel comfortable with that conclusion. There we go.
We are HIPAA compliant.
Yeah. Sorry. Yes.
The doctor will, if the doctor is really concerned about the skin lesion, he will put a ruler underneath and take a picture, because the size of the skin lesion is one of the best indicators of cancer or not, especially over time, if that is changing the size.
Right.
The ones they're not really concerned, it's just pictures, there's no lesions. So when you look at the data set, those that were concerning had a ruler underneath, a small ruler underneath that you could barely see. The models are really good at cheating. An AI model will go and find the ruler. So the model was not really, an AI model was working perfectly well for detecting rulers. It wasn't doing anything else than detecting ruler. That model will not work in production, right? So that's clearly an example of bias at the data collection front, correct? You have bias of representative, like you have a sample that is not representative. Also happen in skin cancer. A lot of the population that goes to skin doctors in the US, the one that, and Dr. Weeks can correct me if I'm wrong here, but there's also more chances of having skin problems, are Caucasians. So these data sets are completely overrepresented of Caucasians. You don't see a lot of African Americans in those data sets. The problem is that if you train a model for that particular population, you cannot use that model in a population that is, those would be an out of distribution problem.
Right.
There are multiple scenarios that whenever we have, no data set is perfect. It doesn't mean that it's not useful. What it means that you need to understand. For example, if you have that model that is trained only Caucasians, as long as you test and you are using this model for that same target population, you're fine, and that may be valuable. Of course, you want every data set to be representative of the whole population. What would be a really big problem is if you suddenly you're using in a underrepresented, or maybe a different country, or clearly people that have different skin colors, those models will not necessarily generalize. There are multiple, no data set is perfect. What is critical is for researchers and people working on that to understand the limitations and see if it will work in the scenario that they need to use it. So,
and Bill, so that's the follow-up is, in your opinion, do researchers understand? And now I suspect, right, the answer at Microsoft is yes, but we see lots of people in the field using AI tools. I mean, not the kind of tools that you're using, but generalized, off the shelf AI tools to diagnose problems, to address issues, and I'm curious from your perspective, whether aside from experts like you at Microsoft and others, whether we can say that there is that kind of understanding about these kinds of biases baked into the technology.
Yeah, that's something I worry about. So when I give talks about this, particularly in the healthcare, it's the same way you would do a quality improvement project. You don't just take something off the shelf and say, okay, tomorrow I'm going to flip it on. I'm going to all 2 million of my patients, we're going to get this, right? You see if it works. So some of the challenges of AI models to me is there should be an inherent cost built in the maintenance and evaluation of the effectiveness of the model. And the reality is that your AI model of today is not going to be your AI model 3 years from now, because hopefully if it's working, some of the population conditions and the priorities have changed in several years, right? So you need to update, you need to monitor, very much like you do with medications, with ongoing kind of surveillance efforts. You need to do this with these models and make sure that they're actually working. So I consider it like a quality improvement thing. You test it, you pilot it, you see if it works, you expand it, see if it works, and then monitor its overall use over time to make sure it's still effective and meeting one of those core quadruple aim goals, right?
And clearly Microsoft, given its industry dominance in this space, can model this kind of good practice, which I hope all other entities would follow in that context. So Juan, you don't have to respond to this one, because now I'm going to share unsolicited health experience, but I want to get Bill's quick reaction to it. I'm going to tell the story quickly, but the short story is December 31st, 1999. I passed out after I was a junior litigation associate in New York. I had been working all day. I went to a concert. I went home and I passed out. And I was in generally good health. Long story short, I passed out twice. Ambulance comes. I'm living in Hoboken, New Jersey. Hospital that will remain nameless brings me into the emergency room. Literally December 31st, 1999. What Prince sang about famously. And they hook me up to machines. Long story short, they tell me that they think, based upon the EKG, I have heart disease, and I am dying. Literally, they said, contact your parents. What's your religion? Literally. And I was in my late 20s and in otherwise good health. I kind of didn't believe it, but on the other hand, they're telling me this. They admit me into the hospital, and this is midnight roughly. About 3 hours later, the first cardiologist that I actually came across, because it was December 31st, 1999, so they didn't have these doctors on staff, comes in, looks at me and says, you're free to go. It literally says you're free to go. Calls in the other doctors, and again, the hospital remained nameless, and basically rips the doctors apart. Why? Because they took this is 25 years ago, right? They took the EKG machine. The EKG machine said abnormal heart rate, and from there they reached their diagnosis. And he basically, probably because he knew I was a lawyer, then proceeded to dictate, how it should have been handled. Here's my question, right? That kind of situation where we rely on machines, right, to solve problems is a time immemorial one. And I was, of course, very pleased to find out that they were wrong and the machine was wrong. But are we any further along in understanding technology and its limitations today in light of the reliance that we now might place on this technology? Because as we talked about, it's so good. In other words, does the risk go the other direction where we're going to rely too much on the technology because, heck, it's better at this stuff than we are? Even though my example suggests it isn't.
Yeah, no, I think so this is something that Juan's always been an advocate for, and everyone in our lab is. There's still got to be a human in the loop, right? Mm-hmm. So these models can give suggestions, they can give guidance, they can make recommendations. There still needs to be your cardiologist kind of looking things over and say, yeah, this is right or wrong. Right. One nice thing that particularly in healthcare that the models can do is you can have explainable AI models, which then helps doctors and helps clinicians understand what's kind of impacting the kind of recommendation at the end. Because we go through, a lot of training like a lawyer does to learn what we did, and we have a pathophysiological basis of disease, and so we want to track that. Mm-hmm. So I think we always have human in loop. We will become more reliant on AI, I bet, just as we became more reliant on stethoscopes when they first came out. It's a moving technology. We will continue to have that reliance. We will have to be careful about its use. We can't follow it willy-nilly. And I mean, one thing I kind of want to point out, given you brought up that example, because I worked in patient safety for a long time, is that the current system is not great either, right? So when there are risks with this, but the current system is fairly imperfect. Since Solutions Leap's famous study in the early 90s has demonstrated that medical errors kill about 100,000 people a year and have done so consistently. So we don't want to let fear of something and kind of modest imperfections make us throw the baby out with the bathwater, right? We want to, it's incremental. We keep humans in the loop. We review this stuff and its effectiveness, and we continuously monitor it to make sure that we're making improvements and not finding more errors.
We have a couple of minutes left, gentlemen, and Juan, I want to ask you quickly about another issue around AI, which is its energy consumption, which is increasingly well known. The Atlantic read an article a few months ago titled "AI is taking water from the desert. New data centers are springing up every week. The question: can the Earth sustain them?" And I'm curious whether ironically it is AI that can help us address that issue, but more generally, how concerned are you about the energy consumption risks associated with this technology?
I think it's important to, I don't, by the way, I don't think it's well understood. Let me repeat that question. I think that it's important to always understand the data behind. Again, we are worried about like everybody else, of anything that generates that is like is the energy consumption. Of course, the data centers require a significant amount of energy. No different, by the way, that if you had people that were using those servers, we need to understand the data centers in many ways. You are concentrating the use of like literally billions of people in many ways that are using these services, and you have a concentration of all of that compute power in a single location. And that's something that people need to understand. And so from a local perspective, at the local level, yeah, we do worry a lot about the energy consumption of these data centers, because at the local level, they can create a lot of stress. And I think that's some of that has been on the press already. But in general, I think is important to understand is we also need to understand the numbers, correct? So right now, there has been a lot of discussions on the emissions of AI. Our estimates and the estimates from other parties too, the whole AI emissions today is less than 0.1% of all emissions in the world. I think it's significantly less than 0.1% of all emissions in the world. And we also need to understand that if you remove AI today, let's say for a minute that you do a massive ban on AI today, and then you have to understand that a significant amount of things in the world depend on AI to be more efficient. And one of the most great examples of this is logistics, correct? So logistics, like moving things, whether you're driving in your car or you're moving things from one place to the other, you are generating emissions. And majority of the companies are already leveraging AI to reduce those emissions. And some of those have been published by like 2030, like just using a GPS navigation plus weather forecasting plus traffic forecasting can reduce emissions in 20 to 30%. So you have to consider, I think it's important. And I will welcome people studying that. I think it's important it's an important study. What is the net benefit in many ways of using AI to reduce emissions? Because like everything else we do, the majority of the things we do will generate emissions. Like watching TV, like if you compare today, the amount of emissions that watching TV, like watching shows, watching Netflix, or watching anything you do in your TV today, the net footprint of that is significantly higher than what you see of people using AI. I think it's important to look at the whole picture and understand. And at the same time, we also need to reduce, make sure that these models become more and more efficient. And even very large models like GPT, the amount of emissions that we have seen from models like GPT have significantly come down because people create, they make these models more efficient. And we hope that that trend continues. So are we worried about the emissions? The net answer to that question is yes, of course we're worried. We're certainly worried about the local stress that data centers can put in energy. That's something that we, of course, we worry. When we look at the whole data set, I think the world has an emissions problem that we need to tackle. But today, when we think about AI, that's not where we should focus the problem. I think we need to understand what is really driving emissions and tackle those problems, and do everything we can to reduce not just emissions for that, but emissions in general, basically. Yep. So I think it's important to look at the whole picture. Like my recommendation to the audience is let's understand the numbers and let's understand the problem here. So
the authors are Juan Ferres and Bill Weeks. The book AI for Good: Applications in Sustainability, Humanitarian Action, and Health. Gentlemen, thank you for joining me today on Hearsay Culture and the Hearsay Culture Network. I look forward to further discussions. I do intend to stay in touch, and thank you for educating my listeners.
Thank you, Dave.
Thank you so much.
Thank you, Paul.